Today, we're going to talk about a truly remarkable story in modern medicine. It's about something called chronic myeloid leukemia, or CML. We're going to dive into what it is, how the treatment for it has been completely revolutionized, and why, for so many people, a diagnosis that used to be terrifying has been transformed into a story of hope.
Let's just start right there, because it's the truth. Hearing the word cancer, well, it's heavy. It can be a really frightening moment, you know? It can feel like your whole world has just tilted on its axis, and being overwhelmed by that is completely 100% normal.
But, and this is a huge but, for this specific type of leukemia, the story has fundamentally changed. Thanks to some absolutely incredible medical breakthroughs, a CML diagnosis today looks so different than it did just a couple of decades ago.
To really move past that initial fear, the first step is always understanding what you're dealing with. So what exactly is chronic myeloid leukemia? Let's break it down.
Okay, so CML is a cancer that gets its start way down in the bone marrow, which is kind of like our body's factory for making blood cells. It's all caused by this one specific genetic glitch that makes way too much of an enzyme called tyrosine kinase. The easiest way to think about it is like this enzyme is a gas pedal for cell growth. And in CML, it just gets stuck down. And here's something that's really crucial for families to hear. Even though it's caused by a gene, CML is not hereditary. You can't pass it down to your kids.
To get a handle on the disease, it really helps to know how it can move along if it's not treated. CML is usually broken down into three pretty distinct phases. First up is the chronic phase. This is where the cancer cells are growing, but they're growing slowly. And this is key. This is when most people get their diagnosis, a lot of times just by chance from routine blood work. If it goes untreated, it can move into the accelerated phase, where things speed up, and then finally into the most aggressive blastic phase. But here's the really good news. Because we're so good at catching it early and the treatments are so effective, many patients never leave that initial, slow-moving chronic phase.
And that leads us right to the turning point in the whole CML story, the treatment. I mean, this is where the true revolution in care has really happened. It's a game changer.
So the number one frontline treatment today is a class of pills you take every day called Tyrosine Kinase Inhibitors, or TKIs. Remember that stuck gas pedal? Well, TKIs are specifically designed to block that overactive enzyme. They basically just let the foot off the gas, stopping the cancer cells from going wild. And they're so good at their job that most people go into remission. Now, a stem cell transplant is technically the only potential cure, but it comes with some really serious risks. And because these TKI pills work so incredibly well, transplants are now basically a last resort, something doctors only consider if the medications stop working. So what's the real-world impact of all these incredible treatments? Let's take a look at the numbers, because honestly, they tell the most powerful story of all.
You'll see this number from the National Cancer Institute, an overall 5-year survival rate of about 65%. Now, I know that number might seem a little low at first glance, but it's so important to understand why. This statistic is an average, and it includes data from years ago, before today's modern TKI drugs were the standard of care for everyone.
So that leads to the obvious question, right? What happens when we look specifically at patients who are actually on these newer targeted therapies?
And this chart just says it all. Look at the difference here. A 2018 study that focused on patients taking a very common TKI called imatinib, well, it found the 5-year survival rate jumps all the way to 90%. That is a massive leap. It just shows you how dramatically the outlook has improved for people getting modern treatment.
So what does this all mean for the future? It means that we can actually talk about living with CML, and that whole conversation is just defined by hope.
So if there's one thing to take away, it's this. TKIs have completely transformed chronic myeloid leukemia. For the huge majority of patients, what was once basically a fatal diagnosis has now become a manageable chronic condition. You know, something you live with, kind of like high blood pressure or diabetes.
And that just leaves us with this really profound shift in thinking. The whole conversation has changed. For most people diagnosed with CML today, the question isn't just about if they're going to survive anymore. The question now is about how well they're going to live for all the years to come.